And good morning, everyone. I'm Mabel, Jong. You're watching WHCC TV, coming to you live from the World HealthCare Congress here in Washington, D.C. We're going to start the morning off with a conversation with Dr. Amar Desai, who is president of HealthCare Partners California. Good morning to you.
Hi, Mabel. Nice to see you.
Well, first, give me some background on what HealthCare Partners is out in California.
Yeah, well, HealthCare Partners is a medical group and integrated delivery network. We're based in Southern California. We serve 700,000 members across Medicare, commercial, and Medicaid. We do this through a highly coordinated delivery model, and we, with our group of medical group physicians, which were employed, and then our IPA doctors who are part of our network. I think the unique thing about HealthCare Partners is that we operate under what are called globally capitated full risk contracts. And that allows us to get the full bundled dollar to do the full coordination of all services for our members. We do this across Los Angeles County, across Orange County. We do it from primary care to inpatient care to post-acute care.
Okay, so California, as we all know, is a huge healthcare market. Is there a difference between serving your members in, say, Northern California versus Southern California?
Sure. We're basically almost exclusively in Southern California, and I think one of the big distinctions that we see between Northern and Southern California is that the Southern California market is actually fairly medical group centric in a lot of ways. It's less consolidated from a health system and a hospital standpoint, and that's just how it's evolved really over the last 30 to 40 years. And what it's enabled for groups like ours is to be able to, number one, work in a very different way with our payer partners, and to be able to take on these capitated full risk arrangements, and then to be at the center point of coordinating the care for the membership. I think in Northern California with different groups such as Sutter and Kaiser, it's more of a health system oriented model. It's allowed us in Southern California to be able to do things with kind of the physician and the patient at the center, which has been a really remarkable thing, and I think it's part of our success in terms of both quality as well as affordability. Your
talk here at the conference this year is entitled Right Size Healthcare. What do you mean by that?
Yeah, so right size healthcare, you know, people talk about it broadly in terms of right care in the right setting at the right time. I think for me, there's two parts to that. One is this notion of appropriate evidence-based care, that the care that we as health systems, as providers, deliver to patients is done with the evidence and what is the most appropriate setting for that care. One, because it's higher quality. Number two, because it is better from a member experience standpoint. And number three, because it actually delivers affordable care within the health system. There's a second part of it that is, I think, in this notion of right time, is that we as in healthcare have to be way more consumer oriented in terms of how we think about our service. We are in a services industry, and we really do need to have a view of how do you deliver a member experience, how do you deliver convenience and access and navigation through the services in a way that consumers find not only easy, but in the best of circumstances, a delightful type of experience to actually go through. So I think that encompasses all of that.
Now, quality is being bandied about a lot. How do you measure high quality, or what's the definition of that at your group?
Yeah, at our group, I mean, we take a few different lenses to it. I mean, there's one which is on core clinical outcomes. How are you doing around a lot of the process measures in healthcare, preventive care, vaccinations, chronic disease care, diabetes and hypertension. But we also take a view around it that is more outcome oriented. Are patients being hospitalized inappropriately? Are they getting readmitted for conditions that they really should not be readmitted for? How are we dealing with ambulatory care sensitive conditions? Things that if you're doing the right thing in the primary care office and in the outpatient setting, that patient should never end up in an emergency room or in a hospital. So we take those lenses on it too. So there's the clinical quality lens, but then to me there is an entire other lens to it, which is the consumer experience lens, the member experience lens, and that lens is very much driven by the perception and the experience that they have interacting with every aspect of our delivery system. So one of the things we track pretty closely across our health system and in different points in which the consumers engage is a net promoter score around how do people rate that experience. And this is not just the experience in the doctor's office. That is one, in some cases, small part of the experience with the call center. The experience with if there is a billing issue that comes up with our billing offices, our entire experience through our network when they go into a hospital partner of ours. How does that experience feel to that consumer, and at what points can we make it more frictionless for them as patients, particularly as they're interfacing with us sometimes at very vulnerable moments, obviously. And so we take both of those lenses on the clinical as well as member experience.
What do you think your strongest touch point is?
Our strongest touch point, we have a remarkable group of clinicians and a remarkable set of care teams. I mean, if there's a spike that we have, it is we are embedded in neighborhoods, in communities. We are oriented to having small sites that are locally oriented, that are really part of the communities that they serve. And so those care teams are oftentimes from those neighborhoods, and they create real linkages into the community and with individual patients. And as I think about the value that we bring, some of the engagement that comes is because you have a trusted relationship, and that's not just with the doctor. It's with the medical receptionist, it's with the medical assistant, it's with the care navigator and care manager who is involved in different segments of your care. I mean, oftentimes the touch points with the doctor is one of 5. The other 4 are with the office staff, are with the care management team, are with a nurse that's calling because there's a lab issue, etc. And so that is our core strength.
So the real follow-up is really there.
The real follow-up is there, and I think to the point around care teams. I mean, I think you have to be as intentional about the teams that you're building and the teams that you recruit for and you train to, et cetera, as you are about any process that you're putting in, because ultimately our product, for lack of a better word, is the people that engage with our patients.
Do you have any news to share with the audience? Anything that's coming up on the horizon with HealthCare Partners?
Yeah, with HealthCare Partners, I mean, we are continue to have a wonderful kind of growth trajectory, and we continue to engage and grow with new patients and new communities. We are doing more with new products that we're launching into the Southern California market. So we last year launched a product with Cigna, which is a commercial product that ends up involving our network as the core network for an EPO style product to consumers, and this is really directed at self-insured employers within Southern California. We're doing something similar with United this year, and the idea behind a lot of this is that the market is looking for affordable plan product offerings that involve a best-in-class network. A network that does all of these pieces we've talked about: coordinate, engage patients in a differential way, create great outcomes clinically as well as from a member experience. And we feel like some of these products that we're developing uniquely do that in terms of from both a clinical quality standpoint, but a member experience and an affordability standpoint.
Okay, and Dr. Desai, may I ask you, how are you finding the conference so far, or who are you trying to reach at this particular meeting?
The conference has been fantastic. My two main goals is there are so many people from across industries here that have such unique experiences in their local markets that between the talks and then the ability really between talks to be able to interact with some of our colleagues that because we're across the country from another, we don't get a chance to. I'm very much excited about being able to do that. I'm certainly excited about Dr. Pearl's talk later in the day, and look forward to the rest of the conference.
Terrific. Thank you so much for your time today.
Thank you.
And thank you for watching. Stay tuned. We have much more content to come.